Hello everybody, I hope this finds you well, and I hope some of you saw some of the sunshine that we've had in Lanarkshire over the bank holiday weekend, and it seems to be, touch wood, continuing this week. So here's hoping that we get another nice weekend coming up, because I think it does make all the difference, doesn't it, to everybody. So I'll start off today just by talking a bit about the data, as I usually do, and then I'm going to talk a wee bit about our strategic direction in terms of remobilisation and some of the commentary now coming out around priorities from the Scottish Government, and in particular our new Cabinet Secretary. So if I start off first of all with the numbers, new case numbers today were the same as yesterday, so 86 new case numbers, which feels like quite a high number. However, at the moment, we're not seeing that translating into lots of hospital admissions. In fact, our inpatients at the moment are sitting around 10. Now, they had gone down as low as 6, and they've gone back up to 13 a couple of days ago, but back down to 10 today. One patient on CPAP, nobody in ICU. One care home outbreak at the moment. So we're seeing a different picture with this disease emerging now. We're seeing high numbers of cases, relatively high numbers of cases, because anything above 50 for us is high. But that isn't translating into admissions, and we're seeing it in younger people in particular, those people who haven't been vaccinated, which is why we're now having a big push on really bringing forward our vaccination programme. So we're now inviting lots of younger people for vaccination, so look out for our social media posts and things around that, but we are now basically moving forward as fast as we possibly can to get people vaccinated so that they have that degree of coverage. So we're pushing the second vaccinations for those who've already had the first, and we've changed the window for that. It used to be 12 weeks, so we've taken that down to 8 weeks between first and second vaccination. So if you're somebody like me who's had their first vaccination, I'll get my second vaccination there at the weekend, and a number of my other colleagues are in the same position, but it won't be for 3 weeks after next weekend where I have the full protection. So really important that we get those second vaccines delivered and that we get first vaccines out to the younger cohorts, and then following that up quickly obviously with their second ones as well. And let's just try and get everybody covered as fast as possible. Lanarkshire is doing a great job in vaccination, and we are really doing well in terms of our numbers. Our numbers today, 407,000 individuals have now been vaccinated, 673 total doses, 1,000 doses now administered, and obviously the difference between those two figures is the second doses. So as I said last week, important, really, really important to keep wearing your face coverings, particularly in public places, and do as much of any socialising that you're doing, do it outside if you can. That protects just everybody. The second thing I wanted to talk about was recovery and remobilisation. And Lanarkshire has started back onto its elective programme, as I told you a few weeks ago. And we've actually done more work as a percentage of those people that we need to treat electively than any other board in Scotland apart from Grampians. So we're kind of second highest in terms of the recovery that we've seen to date in terms of our start point. However, we need to keep that going. And what I would say is we're seeing a big flow of patients coming through our unscheduled care route at the moment, and it's becoming quite difficult to balance our emergency admissions and alongside that elective recovery. So what I would say to you is if you can help us message, if you have friends, family that are thinking of coming to A&E and you know there's a better destination, please signpost them to it, because we are getting still quite a lot of people coming to A&E, sometimes with friends and family, and that's difficult to manage. And sometimes some of the things that they come with could be treated elsewhere. So it's not that they don't need to be seen, they absolutely need to be seen, but maybe not in the A&E. So if you can help us with signposting, we'll keep pushing that through our comms team as well, because we have seen really high numbers in our A&Es. The final thing I just wanted to talk about in terms of going forward, Hunsa Youssef, the new Cabinet Secretary, attended the National Chief Executive's meeting yesterday, and he's outlined 4 care and wellbeing programmes for Scotland going forward. So I thought I would just share those quickly with you today. So the 4 headings are preventative and proactive care. So that's that more upstream approach, trying to take forward things like early intervention so that we don't develop problems further down the line. Integrated unscheduled care. So that's our emergency care pathways, but across the whole system. Integrated planned care. So that's our elective performance. And place and wellbeing. And that 4th one emphasis on well-being is quite new, but it's something the government have been talking a lot about over recent weeks and months, and it's part of the manifesto, and it's a commitment to really including well-being as part and parcel of our economic approach across Scotland. So recognising that a well-being economy is really important, and that we do need to work together to improve Scotland's well-being. So I think you'll be hearing more about that going forward, and I'll try and keep you up to date about how we will incorporate that notion within our own strategy within NHS Lanarkshire. Thank you for listening, and have a nice weekend when it comes.